can mosquitoes be a carrier of this nCoV 2019?
No, thank God. Mosquitoes carry enough diseases, but not this one.
Okay, so this is my personal question, and it's been on everyone's mind: to mask or not to mask?
Let's make it very clear. The only reason you should wear a mask is when you are not well. The main reason the mask is useful then is to reduce the risk to people around you. Is there any other reason for a layperson to wear the mask? The answer is probably not. It's not been shown to be effective.
What are the odds of getting the virus while having dinner in eateries like mamaks and restaurants?
That's cute. It's not a mamak shop at all. It's who you interact with and how you interact with that person, and whether that person has the virus or not. If you're seated far away, your risk is less. If you're seated side by side and you're talking closely, intimately, of course you do carry the risk, just like any human interaction.
Nathan Chew writes, will food or supplements help, for example, to increase our immune system?
I think doctors are supposed to say yes. I don't think we have any strong data, at least for this particular infection, that any particular food supplements would help.
Can a recovered patient get reinfected with the novel coronavirus?
We don't have data on that particular topic yet. I can only assume that it's a bit similar to SARS because they are from the same family. When someone got infected with the SARS virus, they did have antibodies in relation to SARS. And the level of antibodies actually was maintained for a couple of years, 2, even up to 3 years. But whether someone who's been infected with coronavirus, when they recover, can they be reinfected or not? I would think probably not for the short term, but we don't have strong data on that.
Next question, is it true that the virus can spread during its incubation stage before any of the symptoms appear?
There was certainly some controversy about that. Now, that was based on an incident that happened with a Chinese lady who went to Germany for a training course. Now, we know now, when we looked at the data, spoke to the patient herself, that apparently that when she was there in Germany, she wasn't asymptomatic. She did have some symptoms, but the symptoms were fairly mild, and she did take some paracetamol to attend that meeting, and it was then that the interaction with the other German colleagues happened. I think it's a fine line whether the patient was asymptomatic or mildly symptomatic. But what is clear is this: mildly symptomatic patients can still transmit the disease.
Okay, is there a possibility that the virus has gone airborne?
A doctor from Shanghai, he made a comment that the situation is bad in China is because the virus has become airborne. Now, he did not elaborate about how he came to that conclusion, but based on the other coronaviruses, which is two most common, MERS-CoV and SARS, they are droplet spread. We think up to now it's droplet spread. So let's wait to see what evidence the Shanghai folks have to say why it's airborne. If it's airborne, it gets a lot more complicated, certainly.